The content of this program represents the opinions, research, and observation of the host and his assessment of scientific evidence available at this time. None of the statements, claims, techniques, dietary guidelines, or supplements mentioned in this program have been evaluated by the Food and Drug Administration. The information contained herein is for educational purposes only. It is not a substitute for standard care provided by medical practitioners. Any application of the advice presented here is at the listener's own discretion or risk. The information should not be used for self-diagnosis or application. Always consult a qualified healthcare professional before beginning any new nutritional, exercise, or lifestyle improvement program. The host and this station disclaim any responsibility for any adverse effects arising from the use or application of information contained in this program. Now broadcasting from his nutritional command center deep in the heart of Victoria, Texas, charging through the swamp of misconceptions, deception, and myths, bringing to you the newest cutting-edge scientific-based nutrition information so you can enjoy whole-spectrum health, here's the Paladin of nutrition and whole food expert, Labron Allen.
Welcome to this edition of Health Alert. It's Saturday, March 10th, 2012. Boy, do I have a lot of news to go over this weekend. It's pretty amazing how just in 1 week there can be so many different things that start coming out in the news that I think you will find very interesting. But before we do that, I would like to go over some ways in which you can offer me your comments and suggestions regarding the show or any questions that you may have as well. You can first go to our email, which is radiocomments@healthimprovementprograms.com. Again, that email is radiocomments@healthimprovementprograms.com. Additionally, we have a Facebook page for our health clinic here in Victoria. If you want to like our health clinic page on Facebook, what you want to do is go to facebook.com/natural.health.clinic. Again, that address is www.facebook.com/natural.health.clinic. And just like it's there. I post many different things on that Facebook page. There's quite a few different videos that you can watch. There are different studies that have come out regarding both phytonutrients and how they can help the body heal, and also different things about common medications that many persons take today. So there's quite a bit of information on that Facebook page, and I encourage you to check that out. Speaking of videos, you can also subscribe to our YouTube channel. The way you do that is you want to go to youtube.com, and in the search box there up at the top of the page, you'll want to type in NutriDoc 35. Again, that is NutriDoc 35. I have currently about 28 to 30 different videos of health presentations that I've done over the years about various health topics, and I think that you'll find those pretty interesting as well. So again, you go to youtube.com, and in the search box, just type NutriDoc 35, and you can subscribe to our YouTube channel in that way. Speaking of health presentations, twice a month we do free health presentations in which everyone is invited. So you can bring yourself and your friends and your family, leave your dog at home, but you can otherwise bring anyone that you would like. Now, we have these scheduled out into the middle of April, and so I'll just briefly go over what our next one is. The title of this free health seminar that we are holding next, this is on Tuesday, March the 13th. So this is just in a few days. Again, it's Tuesday, March the 13th at 7 p.m., and we hold all of our free health presentations in the same place, and that is at the Hampton Inn on North Navarro, just before you get to the overpass. And we always have them on a Tuesday evening at 7 p.m. Now, the topic of this next health presentation is entitled 8 Mistakes Healthy Eaters Make. So this really has in mind the people who are already putting forth quite an effort to have a good diet, But because of all the myths and misconceptions and different things that we hear through different media sources, whether it's on the radio or on television or reading in books, sometimes we get confused as what really is the best thing to do, and we may find out that certain things that we have thought were quite healthy in our diet really are not. For example, one of the things that we'll be talking about is the use of soy products. Now, soy products are very often in many different things. In fact, there's probably, you could go to your refrigerator or cabinets or pantry right now and pull out a box of something, and in it will have soy lecithin. It may even have soy protein or some other kind of soy product. And so the common thinking is that soy products are really quite healthy. And that is one of the different things that we'll be covering at this free health presentation this coming Tuesday, March the 13th. So we're going to learn if these soy products are really healthy or not, and if they are going to help us in the pursuit of our goal of whole spectrum health. So if you would like to come to this free health presentation this coming Tuesday, we would really like if you would RSVP for it. And the way that you do that is to call the girl at my front desk. Her name is Tanya, and the office number is 575-4683. Again, that office number is 575-4683. Just ask for Tanya, and she will write your name down that you're going to be coming to this free health seminar. There is no cost. There is no obligation, but it is helpful for us to know how many individuals are going to be coming to this free health presentations, because you will be getting a free goodie bag. So we need to know how many goodie bags to bring, and this is one way of us knowing how to do that. All right, so now we're going to get into some of these health news. The first one is actually a new study that was published in the British Medical Journal. And this was a study, a pretty large study actually, covering 24,000 people. In fact, the study came out just February the 27th, just a week ago or so, a couple of weeks ago. And it's regarding sleeping pills. So let me ask you, how many of you listening today are using sleeping pills? Probably there's some out there. Now, of course, we all need to sleep. That is not the question whatsoever. And I'm also not suggesting that you stop taking these medications at all. But it's very important when you do take medications that you are fully aware of the potential health risks that they can create. And very often, we really aren't told about these, or when we are told about some of the side effects, they are very much minimized as to the risk and severity of them. However, this study in the British Medical Journal, again with 24,000 people, they found some very interesting things. In fact, did you know that taking as few as 1 to 18 sleeping pills a year, now that's 1 a year to 18 a year, not a month, certainly not a day. I don't think you'd be waking up from that, but just 1 to 18 a year. If a person takes that amount, there is an association with a 3.6 times, not percent, times increase in the risk of death. Did you know that? Did you know that there is a risk of death in taking just 1 sleeping pill a year? But the study goes on. It says that taking sleeping pills more than twice a week is associated with a 5.3 time increase in death. Okay, so if you take 1 a year, you have a 3.6 time increase of risk of death. If you take 2 a week or twice a week. So that would be what? That would be 8 pills a week, maybe 10, depending on which month it is. So what the study is saying, that if you take 8 to 10 pills a month, that there's a 5.3 times increase in death risk. That's pretty serious. Also, in this study of 24,000 people, that again was published in the British Medical Journal. Now, by the way, the reason that I tell you where these studies come from is because I want you to have the ability to go to your computer or your iPad or your smartphone and actually go into Google, and you can Google in this particular study, and you can find out that what I am telling you is 100% accurate. I don't want you to believe me. I actually want you to go out and do the research for yourself, because that is how you truly become empowered. You, when you do the research, actually know the truth. So I encourage you to do that, and that is why I tell you where these studies come from and on what date. But anyway, besides that, that's getting off on a side there, which you will learn as you listen to my radio programs that I tend to do quite often. But this study went on to confirm that taking sleeping pills not only increases the risk of death, but increases the chances of getting cancer by 35%. Now, that is 35%. It is not 35 times, which is much greater increase, but still significant that just taking sleeping pills increases your chance of cancer by 35%. And if not cancer, it can increase your risk of death by 5.3 times. So that really would make a person start wondering, what can they do in order to naturally help their bodies improve their sleep? You see, there's something that I want to talk about for just a brief moment. Now, there is a model that is followed in medicine. Now, that model is actually, you have a symptom or a set of symptoms, and you go into the medical doctor, and the medical doctor diagnoses or gives a name to that symptom or set of symptoms. Now, that's great. I mean, that is definitely something that is helpful. But the thing is that having a name to those symptoms does not tell you or identify what is causing those symptoms. Case in point, let's say that you have heart disease. Now, this is actually going to go into the other thing that we're going to be discussing today, which is cholesterol, as long as I don't go overtime and keep talking about this for so long. We'll see what happens. But anyway, let's use the example of heart disease. So cardiovascular disease, the common knowledge and thinking is that at some point there is plaquing of some form within the arterial walls. And that plaquing can develop to such a point that, in effect, it closes, or more commonly called, clogs the arteries. And those clogs in the arteries can create serious heart risks. There is no doubt that that is accurate. But the thing is that if you or someone you know has been diagnosed with heart disease or atherosclerosis, which is actually hardening or plaquing of the arteries, that is just a name of what is happening within those arteries, within that vascular system. It's just a name of the symptoms that are occurring. It has nothing to do with what is causing those particular symptoms. Even if they say, well, it's calcium deposits, or it's cholesterol, or it's this, or it's that is clogging the arteries, that is not answering the question as to why the body is allowing that to occur. Now, you see, the body is designed, it has been created to heal itself. Anytime that a person improves their health, did you realize that it is actually the body that has healed? Just think about that when you get a chance. But anyway, the body is designed to heal itself. And so when there are situations going on, like atherosclerosis or hardening of the arteries, there is something that the body is trying to adapt to. It isn't a bad body. It isn't. It didn't just wake up one morning and say, you know what, I'm just going to, give Jane or Bill or Laura or Frank a problem today, and I've decided that I'm going to start hardening my arteries because I don't think that Jane or Bill or Frank or Laura has anything else better to do. Your body doesn't do that. Your body, if it starts doing something that is detrimental in some way, it's really because it is trying to adapt as best as it can to a certain situation. And so just remember that any time that you have been diagnosed with some kind of health issue, it is a name to symptoms and not the cause of the symptoms. And if we, like in the case of sleeping, want to help our bodies to heal naturally, we actually have to identify the cause of what is creating those symptoms. Now, in working with patients, I can say that many of them who have sleep problems, it is related to their way, or shall I say, inability to properly adapt to stress. Now, that doesn't make you a bad person. Adapting to stress is not an easy thing. And you know what? We haven't been taught how to properly adapt to stress. In fact, where did we learn our stress mechanisms, our mechanisms for adapting to stress? Well, in reality, we have learned it from our parents. So just consider your parents for a moment, and you're going to have a very good idea how you overall and over the decades of time will adapt to stress. And if you have parents who are very good at it, then you have literally been blessed because you likely will adapt in much the same way. If you have parents who have not been very good at adapting to stress and different circumstances that have been created within their lives, then those are the people that I'm talking to. So stress is a big factor many times in the lack of sleep. And so one of the simple things that we can do is we can begin to learn different mechanisms that will help our bodies to relax. In fact, what we're really trying to do is help our bodies go into a part of the nervous system that is called parasympathetic dominance. That means that that part of the nervous system, the parasympathetic nervous system, is what is dominant at that time. The parasympathetic nervous system is responsible for healing our bodies, for regenerating our tissue, for detoxifying, for restructuring our cells, for digesting food, for reproducing, in effect, our entire bodies. So that's a pretty important system, and that is the dominant state that you go into as you sleep. Now, there's a rub here, and the problem is, the catch-22 is that if you cannot go into parasympathetic dominance, then you also are going to have a very hard time going to sleep or staying asleep. So not only do you go into parasympathetic dominance as you're sleeping and your body begins healing, but if you cannot go into parasympathetic dominance when you lie down to rest, then you're going to have a hard time sleeping. So what are some of the mechanisms that you can do, that you can work on in order to help your body relax and to deal with its stress? Well, you may have heard of this. Not some, but actually many top athletes use this particular technique. And no, it's not exercise, although certain forms of exercise can be helpful in the reduction of stress. What I'm referring to is visualization techniques. Now, visualization is extremely helpful. In fact, referring to athletes, if you know any top athletes, you ask them a question as to what is most important, their physical condition or their mental condition, most of them will tell you, you know what, 90% to winning in whatever competition it is that they compete in is mental. 90% is mental. Just about anyone can exercise their body to the point of which they will be fit enough to compete in many of these things, as long as they're within a reasonable age category. But not many people have the mental conditioning necessary to compete at high levels. That is where it's at. That is where the winning or losing is really at. So visualization techniques, let's say that you've had a very stressful day. One thing that you can do as you're laying in bed trying to go to sleep is that you can use the visualization technique of making some of the events that occurred in that day just completely comical. You know, blow up the person's head to a caricature size, make it look ridiculous, make it kind of cartoonish in nature, and play through that scenario to the point that it starts humoring you, is the idea. So you can just play around with that idea in different kinds of situations in your life and see if that actually helps start calming you down. You'll find that that simple technique really does do that. Another technique that you can use, it's like a relaxation technique, somewhat like a meditation technique. The only thing is that when you say meditation, some people think it's like yoga and you're chanting something or something like that, and that's not what I'm referring to. Meditation as in you're considering something very carefully, mentally, but only that thing. For example, there are relaxation techniques that as you're sitting down or laying down, you can start at your toes and consciously relax each toe individually, work up the foot, work up into the ankle, consciously relax those muscles of the feet and ankles, work up into the calves, relax your calves, and work farther up into your quadriceps, into your thigh, hamstrings, and feel those muscles relax into your gluteus maximus, into your buttocks. Allow those muscles to relax, and just work up the body until you can get as much of those muscles relaxed as possible. That technique tends to be very, very good for many individuals, and they find that to be very, very helpful. So some of those things can be done to help your body go into parasympathetic dominance and help you sleep, perhaps, possibly, with your medical doctor's supervision without the use of medications. Now, sometimes there are other factors involved with sleep, for example, and there can actually be biochemical imbalance that might actually be aided or supported, would be a better word, with nutritional supplementation. For example, if you find yourself oftentimes waking up, let's say between 1 and 3 or 2 and 5 in the morning, and your mind just turns on, and it's thinking about this, and it's thinking about that, and it just won't stop, and it's driving you crazy, that shows a specific biochemical imbalance that really the sleeping medication is not helping. What that biochemical imbalance is actually high cortisol levels, likely due to your blood sugar dropping during the night at some point. Now, there are specific things that you can do as far as different kinds of supplementation that will help those particular biochemical processes, that will support those biochemical processes and allow the body to do its job of sleeping. Now, how would you learn about what you need for that? Well, what you would do is you would come to a free health presentation and learn about how you might be able to become a nutrition case, a nutrition response testing case, get on a health improvement program, and really learn through nutrition response testing, which is a technique that analyzes the body's response and analyzes where there are nutritional deficiencies within the body as it pertains to some of the difficulties that you may be experiencing. You will learn how that could be a help to you, what it actually is, and what you need to do in order to be part of a health improvement program. So again, I encourage you, as I mentioned earlier, to come to one of our free health presentations. The next one, again, is Tuesday, March 13th at 7 p.m. at the Hampton Inn. Everyone is welcome, and the topic, again, is 8 mistakes that healthy eaters make. Okay, so switching gears here. By the way, I did not even get close to finishing the amount of news that I wanted to go over. I literally have a pile if you can hear that, this is a pile of different studies that I was hoping to go over, but I just did one. So what I want to briefly cover, because I promised that I would, I really haven't given myself much time to do that, but I want to rapidly go over cholesterol. Now, we talked about last time that the common thinking is that there is a relation to cholesterol and heart disease and a relationship between what you eat as far as saturated fats, okay, and cholesterol. And I read to you the medical textbooks that med students use to learn to become medical doctors, showing you that the correlation between food diet and high cholesterol levels is minimal. 15% at most is there a change or increase with cholesterol levels. So the question is, what does increase cholesterol levels? Well, that's a good question. And there actually is an answer. Again, going to the textbook of medical physiology by, who is this here? Guyton and Hall. Guyton and Hall are the authors of the textbook of medical physiology. It says that there are some factors that affect plasma cholesterol concentration. So let me interpret that for you. Cholesterol levels in the blood. All right. It says, and I quote, an increase in the amount of cholesterol ingested each day increases the plasma concentration slightly. Okay. So we covered that. So the amount of cholesterol ingested in foods, like you eat eggs, it only increases it slightly. It goes on to say about 15%. So then the question is, what does create the higher cholesterol levels if it's not cholesterol in the diet? Well, on page 964 of the textbook of medical physiology by Guyton and Hall, it says, and I quote, when the quantity of glucose, listen closely, when the quantity of glucose entering the liver cells is more than can be stored as glycogen, okay, so the liver converts glucose into glycogen. It stores some of that glycogen within the liver as well as in the muscles. And when there becomes too much, more than can be stored in the muscles, then the remaining glycogen is diverted back into the liver. So let's continue. It says, when it is more than can be stored as glycogen or can be stored for local hepatocyte metabolism, that means metabolism through the liver, just to interpret for you, insulin, you ever heard of that hormone before? Diabetics have problems with insulin. Insulin promotes the conversion of all this excess glucose into fatty acids. So that means that glucose, that hormone, converts basically sugar or glucose into a fatty acid. It goes further and says these fatty acids are subsequently packaged as triglycerides in very low density lipoproteins, so that's known as VLDL, and transported in the form by way of the blood to adipose tissue and deposited as fat. Let me interpret in very plain English. When you have too much glucose, then the liver, or the insulin rather, is used to convert that remaining glucose into fat, known as triglycerides. So, by the way, if your triglyceride levels are above 100, you need to listen to this very closely because it means that you are consuming too many foods that have too high levels of glucose for you, causes an increase of insulin. So those remaining glucose stores are converted into fat and deposited within your fat cells, which means around your waist, in your hips, in your thighs, in your buttocks, in your arms, all those areas that you don't like, that's where it's being deposited, especially around the midsection, by the way. That's where this particular type of fat tends to be deposited. So here is a key. The higher your glucose levels are within the blood, the higher triglyceride levels are going to be, and quite likely, the higher your cholesterol levels will be. So, next week, we will have a continuing information about cholesterol. We will go into those studies that I mentioned, the Framingham and Tecumseh studies, the two largest studies that are used to, quote-unquote, prove that there's a connection between cholesterol and heart disease. So I want to encourage you to comment or any suggestions that you might have, any questions you might have, email that into our program email, which is radiocomments@healthimprovementprograms.com, or go on to Facebook at facebook.com/natural.health.clinic, and you can like our page there, and I'd be happy to hear from you on that page, as well as you'll find quite a bit of information. So until next week, this is Labron Ellen with the Natural Health Clinic, and I invite you to tune in, and we'll continue that conversation about cholesterol next Saturday on Health Alert.